John E. McDonough helped write the Affordable Care Act, first as a Massachusetts state rep, later as a Senate committee staffer. He teaches health policy at Harvard now, and today he's got a new book, America's Wrong Turn, U.S. Healthcare in the Neoliberal Era. His argument is that the real damage didn't start with the ACA fight, which I think we know that. Sorry. I want to scream. Sorry, John. I didn't mean to expose you to that. Started decades earlier in the Reagan years, quietly while nobody was watching. And it's still playing out now aggressively in your mailbox in the renewal notice that you just told you your premium's going up again. John, thank you for joining us today and all the work that you've done. How are you doing today, sir?
Great, Patty. A pleasure and honor to be with you tonight.
Let me just ask you personally, was this sort of a slow, we talk about the frog in the water, right? If you just turn the water up slowly, the frog doesn't really notice it's about to boil. If it's hot, it jumps out right away. This was a slow boil, wasn't it?
Well, it was a slow boil in the 70s, the 1970s. But then when Ronald Reagan came in as president in 1981, then it actually started to take off like a rocket. And so we have seen the growth of spending, and you can track it into those early years of the 1980s when you can just see the split between the US and every other nation. We have examples like, for example, managed care health maintenance organizations. When they started out, they were all nonprofit. And when the Reagan administration came in, they said, we like these things, we want to keep them, but we'd like to see them all go for profit. And by the end of the decade, most of the managed care industry was for profit, owned by shareholders and responding to investors rather than the people who belong to them. And we see that all over. We've seen this massive increase in monopoly and corporate concentration and antitrust. And it is probably the leading reason, according to a lot of really smart younger economists, the major thing why healthcare is so expensive is because we've had 45 years of this amazing corporate concentration where big companies like United Healthcare and CVS have been able to swallow up everything around them.
And, with that, when you say that, they wanted it to be privatized, they wanted it to be for profit, they didn't want to be the nonprofits doing this anymore. What was there any one or several elements that drove that? Some folks, I know Tom Hartman talks about, in part, some of the racism that, they didn't want to have public health available to minorities, that if they were going to have that, everyone should be paying for it kind of mentality. What would you say are some of the factors that played into that?
Well, let's say so. One of the major factors. So the father of neoliberalism in the United States was the economist Milton Friedman, who started working in the 50s and 60s. 1970, September 13th, 1970, he wrote an op-ed in the New York Times, the Sunday New York Times, which basically said the only purpose of the for-profit corporation, the only reason it exists is to provide maximum financial returns to their shareholders and nothing else. Anything about responsibility to your customers or patients, anything about duty to workers, anything about obligation to communities or the environment, he just said, listen, that's just wrong. It's all about making the maximum amount of money. And that included healthcare, and healthcare got swept up in all of that. And the process, there's a fancy word for the process. I hope this is okay.
Yeah.
The fancy word is financialization. So you have people coming into the healthcare sector and buying up, say, home healthcare companies, hospices, veterinarian shops, whatever, buying them up and rolling them up into these bigger conglomerates that they can then sell for a massive profit. And they're not doing it because there's any commitment to providing care on itself. It's just a vehicle where they can make the maximum amount of money to give back to their shareholders and their owners.
For those who are just listening to the radio, like I'm making a lot of faces because this is kind of, I mean, we know these things. We know that it's for profit, that our lives are only for, like, I'll be very honest. My father had small cell lung cancer, which is a very aggressive form of lung cancer that travels through the bloodstream and was reaching his brain. And so it's not something that's operable. It's not like you can cut out a part of the lung, but he also at the same time had an aneurysm. And I was on the phone with a surgeon who told me that they had decided that and this is a while ago, but this is before Sarah Palin said we had death panels. I personally heard it on the phone when they said that it was a $40,000 surgery, that they did not feel that my father met the standard to be worthy of that surgery, essentially. And I just remember thinking, and so basically, if I had $40,000, I could pay for that surgery. I mean, and so, you know, your brain like sort of implodes when you're fighting for someone's life. What I tell folks when I have a company called With Kind Words about how medical practitioners and at every level can communicate with patients, because in every instance it's about love, right? You want your loved one to be here with you. You want them to be healthy and safe. And so you know, the fact that we're basically just on a spreadsheet, and I get that that's for profit, but in comparison, all this fragmentation, tell us about how that makes really everybody vulnerable when it's so fragmented like this.
Well, every other system in advanced nations around the globe, you know, France, Japan, Italy, England, whatever, they all have a system where there's one central source of organization and financing for the system, so that there's a level of treatment of people. Everybody's kind of equal in terms of the health systems around the world. In the United States, if you're elderly, you go into Medicare. If you're poor, you go into Medicaid. If you work for an employer, you go get your employer insurance if your employer offers it to you, and for different levels of value and care and so forth. If you can't get any of those, you can try to get coverage through the Affordable Care Act marketplaces. If you're veterans, you go into Veterans Health, Indian Health Service. No other nation in the world fragments and puts all these different pieces together where you have to figure out where you fit into the puzzle. You have to figure out the puzzle. Each one has its own bureaucracy, its own set of rules, its own set of practices, and it creates incredible waste, incredible extra spending, and it doesn't meet the needs of people. We've got a real conflict in American society around healthcare because the corporate ownership believes in the principle of maximizing shareholder value. MSV is the term of art for it. And that is where the owners are coming from. And then the patients and the physicians and the providers are coming from what's referred to as the Hippocratic Oath,
Yeah.
which is that you exist for patients first. So you've got a system right now that's at war with itself, with the profit motive exploding and people losing their place in line in terms of what has always been the mission of medicine in the United States, which is patients come first.
Yeah, I just have always, I don't know why, even after all these years, when I've seen it firsthand, I still can't believe that we have gone so far down this path. And I think for a lot of people, it feels as though there isn't any turning back. What do you want to tell folks that feel that way?
There's always a turning back. Well, it's not so much a turning back.
Right. That's a good point. Because turn around, goes a different way. Yes. Thank you. I want to go back.
Go a different way. No, we don't want to go back.
No.
Because there's never been a great day in American history of medical care. There's always been issues. But we need to go forward, and we need to go forward in a different direction in ways that we create much more of a system that is equal for everybody, in a way that people can afford, without these massive cost sharing of deductibles and co-insurance that are driving people into medical bankruptcy. We've got over $250 billion in medical debt that people can't afford to pay, that's being carried in the system. We have a system that denigrates and belittles the workers in that system, including the physicians, who are more and more just financial cogs in the wheel. So there's a need for a kind of a revolution here, and we can see it.
Yes.
We know what it is. We know what it is. We know what it can be. It's awfully difficult politically to get there in one big leap, because it's going to take 60 votes in the U.S. Senate just for starters to try to get there. Even if you had 60 Democrats, I doubt you'd have 60 Democrats willing to go this way. But there are important, big, major steps that we can take now and going into the next couple of years when there's going to be a lot of change happening. So I'm an optimist.
Okay.
I think that this is important enough and big enough that we can get our arms around it and we can make major, important, fundamental change happen for the American people.
And if you've been doing the work and you're still optimistic about it, and you've looked at this from all the angles, the history of it, the practicality of it, then I should also be optimistic about it. I don't know if I can say. I can't even say optimistic about healthcare in the United States. Do you mind sticking around for another segment, my friend?
Happy to do so. Thank you.
I appreciate it. We're gonna take a break. Don't go anywhere, everybody. When we come back, we're gonna talk more about what folks should do, and getting this in front of their electeds. I want to talk about the Affordable Care Act, the work that John McDonough has done in Massachusetts, because we all know that was the basis for the Affordable Care Act. So I want to learn more in that regard. So more after this on WCPT 820 Heartland Signal, KKNW 1150. Of course, all of our friends tuning in digitally. We appreciate you. More in a moment, if I can find the right button to push back here. I have I've got a lot of mice. Stand by.
You're listening to Driving It Home with Patty Vasquez.
Thank you so much for joining us as we continue our drive home here on WCPT 820 Heartland Signal, KKNW 1150, and our friends tuning in on Facebook, YouTube, and now Minocqua Brewing Company Substack. We are on the line with John McDonough. He is a former state legislator from Massachusetts. I really, the work that you have done is really remarkable. He helped write the Affordable Care Act, first as a Massachusetts state rep and later as a Senate committee staffer. He teaches health policy at Harvard, and his new book is America's Wrong Turn: U.S. Healthcare in the Neoliberal Era. And we've been talking about how obviously the damage has been going on for decades. And I said, how can we go back now? But I think what I often think of is like at least having some sense or some path forward for reining it in, I guess is what I'm talking about. So tell us a little bit about as one of the writers of the Affordable Care Act, first the Massachusetts healthcare plan under Governor Romney. Is that when you were working on this?
It's 2006 that happened. Yes, absolutely.
So, so what was the sort of marching orders that you guys? How did this was it a committee that started, and you thought, let's create something that's statewide first?
It was complicated. It involved federal money that the Bush administration was going to pull from the state in our Medicaid program. And so our governor, Mitt Romney, and our U.S. Senator Ted Kennedy got together, and we all worked up a scheme to create the nearest we could come to universal health care as a way to hold on to the federal money. And the Bush administration decided to let us have it. And that's how that worked. But so we reduced our uninsurance from about 7% down to around 2%, just level that had never been seen before in any of the 50 states. It's still between 2 and 3%, except for what's happening now with the Trump administration. So so that was the explicit goal. How much can we drive this down? And we did some things that were controversial. We included an individual mandate in it that became part of the Affordable Care Act. But we did it, and we made the coverage genuinely affordable for people so that people could afford to take it and get it and not put themselves into financial harm by doing it. It took more time to do it with the ACA. It finally happened under President Biden in 2021 when they created the enhanced subsidies for that coverage. And for about 4 years, we had uninsurance in the United States down to the lowest rate it had ever been, about 7.5%, which still seems like a lot, and it is. Every other nation, every other advanced nation covers 99 to 100% of their people. Every one of them.
Where were we when we passed the affordable? Was it because I remember it being like 18% or 20%?
We were 16 to 18%. Absolutely, depending how you count.
Yeah, that's my memory of it.
Just stunning. We got it down to about 7.5%. So that was extraordinary. Now, unfortunately, under the Trump administration, we're going back up again.
Well, yeah.
And we don't know how bad it's going to be, but it's going to be bad because of their so-called One Big Beautiful Bill Act and their other changes that they did to the ACA and elsewhere. They're just, they gave up trying to repeal the whole thing publicly. They realized that in 2017, but now they're back and they're doing it through smaller bites that are quite harmful and quite painful in terms of America's coverage. And it's going to be a real problem.
What are there any elements of the original Affordable Care Act that I haven't heard any sort of specifics on the things that they're trying to claw back? I mean, are pre-existing conditions still at least part of it for now, or is that vulnerable at all?
That's gonna stay.
Okay, kids on our insurance still are 26.
The kids that's still there. That's all okay.
Okay.
What they're doing is they're making it a lot more difficult for people to stay in the Medicaid program who got in under the ACA. They're creating a bureaucratic nightmare. They're calling it work requirements. But the truth is that about 80% of people in this coverage already work. And a lot of the ones who don't have illnesses, mental health issues, other kinds of things that make it really difficult for them to be able to hold down a job. But so they're going to start kicking people off in January who can't document that they work 80 hours a month. And it's going to be a real difficulty. We're going to lose millions of people are going to lose coverage just because of that. And then the Affordable Care Act marketplaces, they provide coverage for people who can't get Medicare or Medicaid or employer coverage. And they finally became genuinely affordable over 2021 to 25. And then the Trump administration let those extra subsidies expire. And now everybody in that sector is seeing their premiums go up enormously, as well as their cost sharing. It's just really shameful.
Something that struck me, and as I mentioned earlier about my dad, what it seems to me is that when you're for profit, when everything is to maximize the amount of money you can make off of a human life, then the human life becomes disposable if it's not giving you profit.
Without a doubt. And that's what we see. We see that all over. And we see it in multiple ways. We see it in differences in terms of, people who are non-white, people who are more low income, people who live in rural areas in particular are significantly vulnerable to just different treatment where they just can't get the kind of care that everybody expects everybody should have. But now it's going broader rather than more narrow. We're going in the wrong direction right now under this new administration, the Trump people.
You mentioned that you are optimistic. I have so many more questions, and I think I need to read your book and then have you back to talk more because I have so much more I know we could discuss. But I opened the segment saying healthcare is a crisis of every generation now, mine, my mother's, my kids. And you say that you are an optimist. If you had to leave our listeners with one thing to carry into this fight, one thing they can actually hold on to, what would that be?
When things get bad, that then creates the public momentum to go forward and to make it better. And we're going to see those opportunities come up starting next year, next January. We're going to see it particularly perk up in 2029. It's a little bit like 2005 and 6 right now relative to the ACA passing in 2010. We're on the pathway. We've got a positive feedback loop that's just ready to get started, and I think that the challenges and the profile of the healthcare problems people are having are going to summon up public demand for action that's going to be met probably in 2029 and 30.
Okay. Well, I look forward to reading your book again. Where's the best place that you would send folks to find your book?
Go to the website of the Johns Hopkins University Press.
Okay.
And use the code 4 letters HTWN, and then you get 30% off the price.
Oh, fantastic. And the book is America's Wrong Turn, U.S. Healthcare in the Neoliberal Era by our guest, John E. McDonough. It was a pleasure talking to you and meeting you, sir, and I look forward to our next conversation.
Thank you so much. Happy to come back anytime.